Hello friends, this is Rajdeep. Welcome to Learning Insight for UGC NET-JRF Social Work, and this is our Unit 9, and in this video we'll discuss mental health and diseases and some symptoms, causes, risk factors, then complications, prevention, treatment and legislation of mental health. So if you are new in this channel, consider for subscribing because you will get all the videos for your NET-JRF preparation. So let's start. Okay, so mental health and and diseases. For that, some of the key facts are there are generally characterized by a combination of abnormal thoughts, perceptions, emotion, behavior, and relationship with others. So, when the combinations of thought, behavior, perceptions, emotion, and relationship, these are abnormal, combination of abnormal, then it's called mental disease or mental disorder. Now, mental disorder include depression, bipolar disorder, schizophrenia, and other psychosis and dementia and development disorder, including autism. Now, there are effective strategies for preventing mental disorders such as depressions, and there are effective treatment for mental disorder and the way to alleviate suffering caused by them. So there are different strategies for preventing, there are different strategies for treatment. Access to healthcare and social services capable of providing treatment and support. Social support is the key. Now next, okay, what is mental illness? Now mental illness is also called a mental health disorder, refers to a wide range of mental health condition, disorder that affect your mood, thinking and behavior. Remember, disorder that affect your mood, thinking and behavior is some kind of mental health, a mental illness or mental disorder. Now example of mental illness like depression, anxiety disorder, schizophrenia, then eating disorder and addictive behavior. Now, addictive behavior, eating disorder, schizophrenia, and anxiety disorder, depression, these are mental illness. Now, many people have mental health concern from time to time, but a mental health concern become a mental illness when ongoing sign and symptom cause frequent stress and affect your ability to functions. So sign and symptom that cause frequent stress and affect your ability to function, then it's called mental illness. A mental illness can make you miserable and can cause problem in your daily life, such as at school, at workplace, at in relationship. In most cases, symptoms can be managed with a combination of medication and talk therapy like psychotherapy. So what are the symptoms of mental illness? Sign and symptom of mental illness can vary depending on disorder, circumstances and other factors. Now mental illness symptoms can affect your emotions, your thought and behavior. So these are the symptoms that affect your thoughts, emotion and behavior. For examples of mental sign and symptoms of mental illness like feeling sad and down, confused thinking or reduced ability to concentrate, excessive fear or worries, or extreme feeling of guilt, extreme mood changes of high and low, then withdrawal from friends and activities, significant tiredness, low energy, and problem sleeping, detached from reality like delusions, paranoia, and hallucinations, then inability to cope with daily problem or stress, trouble understanding and reality to situation and relating to situation and to people, problem with alcohol or drug use, major changes in eating habit, sex drive changes, excessive anger, hostility or violence, suicidal thinking. So these are the signs and symptoms for your mental illness. Now, sometimes symptoms of the mental health disorder appear in physical problem also, such as stomach pain, back pain, headache, and other unexplained aches and pains. Now, what are the causes of mental illness? Mental illness in general are thought to be caused by a variety of genetic and environmental factors. So remember, it's a both genetic and environmental causes. Genetics, so we'll discuss this. Inherited traits means genetic traits, like mental illness is more common in people whose blood relatives also have a mental illness. That means it's a blood relationship disorder, or you can say it's a inherited or is a genetic. Now, certain genes may increase your risk of developing a mental illness, and your life situations may trigger too. Now, in environmental exposures before birth, like exposure to environmental stressors, then inflammatory conditions, then toxins, then alcohols, drug while in womb can sometimes be linked to mental illness. So these are the environmental exposures before birth or during pregnancy of a lady. So these are the environmental factors that can cause a mental illness. Now, brain chemistry is another causes, like neurotransmitters are naturally occurring brain chemicals that carry signals to other part of your brain and body. When the natural network involving these chemicals are impaired, the function of nerve receptors and nerve system changes, leading to depressions and other emotional disorders. Now, what are the risk factors that increase your mental illness in more higher levels? So certain factors may increase your risk of developing mental illness, including a history of mental illness in your blood relatives such as parent or siblings, then stressful life situations such as financial problem, a loved one's death or a divorce, an ongoing chronic medical condition such as diabetes, brain damage as a result of serious injury like traumatic brain injury, traumatic experience such as military combat or assaults, use of alcohols or recreational drugs, a childhood history of abuse or neglect, then few friends or few healthy relationships, a previous mental illness. The mental illness is common. About every among the 5 adult, one have a mental illness in a given year. Now, mental illness can begin at any age from childhood through adult, later adult years. That means in the old age also, but most cases begin in earlier life. The effect of mental illness can be temporary or long lasting. You also can have more than one mental health disorder at the same time. For example, people may have depression and a substance use disorder simultaneously. So people have a more than one disorder at a time. Now, what are the complications of mental illness? A mental illness is a leading cause of disability. Untreated mental illness can cause severe emotional, behavioral, and physical health problems. So, if your mental health illness is not treated, then its effects on your that affect on your emotional, behavioral, and physical health problems. Now, complications sometimes linked to mental illness include unhappiness and decrease enjoyment of life, family conflict, relationship difficulties, social isolation, problem with tobacco, alcohol, and other drugs, missed work or school, or other problems related to work or schools, legal and financial problems, poverty and homelessness, self harm and harm to others, including suicide or homicide, then weakened immune system, so your body has a hard time resisting infections, heart diseases, and other medical conditions. So these are the complications which leading to some kind of a mental illness that is leading to cause a disability. Now, what are the how the it can be prevented, or how this mental illness can be controlled? So there are no sure way to prevent mental illness. However, if you have a mental illness, taking step to control stress, to increase your resilience, and to boost low self-esteem may help keep your symptoms under control. So, the following are the steps that can be taken to prevent mental illness. First one, that pay attention to warning signs. So, which sign is the most leading to your mental illness, that must pay attention. Get routine medical care. Get help when you need it, and take good care of yourself. So, these are the preventive strategies. Now, classes of mental illness, the main classes of mental illness, there are many classes of mental illness, and honestly, I should take one session on the different classes of mental illness, and like neurodevelopment disorder, and we should have a full discussion on each of the mental classes of mental illness. But I don't know whether I have a time to take one more session on that topic. So let's see what happens. So we'll just discuss in this video just the name of the mental illness, that different classes of mental illness. So classes of mental illness like neurodevelopment disorder, schizophrenia spectrums and other psychotic disorder, bipolar and related disorder, depressive disorder, anxiety disorder, obsessive compulsive related disorder, trauma and stressor related disorder, dissociative disorder, somatic symptoms and other related disorder, then feeding or eating disorder, elimination disorder, awake disorder, sexual dysfunctions, gender dysphoria, then disruptive impulse control and conduct disorder, substance related and addictive disorders, then neurocognitive disorder, personality disorder, paraphilic disorder, and other mental disorder. These class include mental disorder that are due to other medical condition and that do not meet the full criteria for one of the above disorders. So these include other mental disorder. When these are not come under these classes, then it's called a mental disorder. Now moving to the treatment. Okay, your treatment depend on the type of mental illness you have. It's severely and what works best for you. In many cases, combination of treatment work best. Means not a single treatment plan. Sometimes it's a combination of many treatment plans. If you have a mild mental illness with well controlled symptoms, treatment from your primary care provider may be sufficient. In case of mild mental illness, means minor, but however often a team approach is appropriate to make sure all your psychiatric, medical and social needs are met. So it's you make sure that your psychiatric means mental related issues, then physical, so that medical issues and social needs are made through this treatment plan. This is especially important for severe mental illness. In case of severe mental illness, means in a dangerous situation mental illness, such as schizophrenia. So in that plan, in that time, your psychiatric, medical and social needs to be met. Now your treatment plan may include family or primary care doctors, nurse practitioners, physician's assistants, psychiatrists, a medical doctor who diagnose and treat mental illness, psychotherapists such as psychologist or licensed counselor, pharmacists, social workers, and then family members. So these are your treatment team members who will support you, will give care, provide care you for your mental illness. Now medications. Although psychiatric medications do not cure mental illness, they can often significantly improve symptoms. Psychiatric medications can also help make people other treatments such as psychotherapy more effective. The best medications for you will depend on a particular situation and how your body responds to the medications. Some of the most commonly used classes of prescription psychiatric medications include antidepressive, used to treat depressions, anxiety, and sometimes often other conditions. Now, anti-anxiety medications are used to treat anxiety disorder such as generalized anxiety disorder or panic disorder. Now, mood stability these medications commonly used to treat bipolar disorder, which involves alternating episode of mania and depressions. Antipsychotic meditations used to treat psychotic disorders such as schizophrenia. So these are the medications you can use for your treatment plan or medication, psychotic medications. Remember why I am discussing all these things, because these are the some area which is most important for assertion purpose also, or comprehension purpose also. They, in the most of the time, assertions, they take the topics from this kind of area for your assertion and reasoning. So in that case, this video will helpful for you as well. So other treatment plan can be psychotherapy, brain stimulation treatment, hospital and residential treatment program, substances misuse treatment, participating in your own care. So these are the, in most cases, a mental illness won't get better if you try to treat it your own without professional cares, but you can do some things for yourself that will build on your own treatment plan. So these are, mental illness cannot be treated by yourself only. You need to some professional care as well. Like, stick to your treatment plan, avoid alcohol and drug use, stay active, make healthy choices, don't make important decisions when your symptoms are severe, determine priorities, learn to adopt a positive attitude. So these are the certain treatment plans that you can make your own. But remember, in case of mental illness, because it's a severe illness and you need a professional care. Now, coping and support. Coping with a mental illness is challenging. Talk to your doctor and therapist about improving your coping skills and consider these tips. Learn about your mental illness, join a support group, stay connected with family and friends, keep a journal and record. Now, the mental health legislation is very important for you to know. Legislation that govern how people with mental health conditions receive care and treatment. They are Mental Health Act 1983, updated by the 2007 Act. So this mental health is updated in the year 2007. Now, and the Mental Health Capacity Act 2005, including the deprivation of liberty safeguards. In India, the Mental Health Care Act 2017 was passed on 7th April 2017, and it came into force from 7th July 2018. So remember, this act is very new, fresh act, and it's very important to know Mental Health Act, the Mental Health Care Act, and it was launched in the year 2017 and it came into force in the July 2018. So this is all about. If you like the content, please consider for subscribing, and do like, share with your friends and your dear ones who wish to crack JRF or NET from social work. Thank you. Thanks for watching.